Hello, this is Dr. Joanne Manson, Professor of Medicine at Harvard Medical School and Brigham and Women's Hospital. I'd like to talk with you about a recent report on the AHA's Life's Essential 8 metric and its association with both life expectancy and with health span, or life expectancy free of chronic diseases such as CVD, cancer, diabetes, and dementia. This study leveraged the UK Biobank and included more than 135,000 UK adults with a mean age of 55. And the AHA metric was defined as including 5 lifestyle behavioral factors, including not smoking, regular physical activity, healthy weight, healthy diet, healthy sleep, defined as an average of 7 to 9 hours nightly, as well as having blood pressure, blood glucose, and non-HDL cholesterol in a healthy range. Now, this study was just published in JAMA Internal Medicine. I'd like to acknowledge I'm a co-author of this study along with my colleagues at Tulane. We divided the study population into 3 groups: those with low, moderate, and high scores on the Life's Essential 8 metric, so low, moderate, and high cardiovascular health. And we overall, in this study population, the average life expectancy free of chronic disease was estimated to be at age 50, 25 additional years in men and 30 additional years in women. But interestingly, there were large differences across the Life's Essential 8 metric group. So those who had high cardiovascular health scores tended in men to have an additional 7 years of life expectancy free of chronic disease compared to those who had poor scores. And in women, the difference was about 9.5 years between those with high scores and those with lower scores. Also, the number of years lived with chronic disease was compressed in those who had better cardiovascular health scores. They tended to have fewer years living with those chronic diseases, while they were having more years living free of chronic diseases. We were interested in looking at how these results might differ by socioeconomic status, by educational level, income level, as well as the Townsend deprivation score. And intriguingly, we found that the gain in life expectancy free of chronic disease was very similar across all of these socioeconomic strata. So even those with lower education, lower income gained as much in terms of chronic disease free life expectancy as those who were in the higher socioeconomic strata. So overall, I think the findings make a compelling case for the importance of lifestyle factors in extending health span and years free of chronic disease. I think this can be motivating to tell our patients that healthy lifestyle not only extends life expectancy, but also extends years of health and number of years lived free of these chronic diseases. Nonetheless, we do have many health disparities in terms of life expectancy and health span. So it will be very important to population health standpoint to do more in terms of narrowing those health disparities through education about the importance of lifestyle factors, also more research on implementation of lifestyle factors and lifestyle behaviors, as well as public policy in terms of making healthy lifestyle both affordable and accessible to all people across all of these socioeconomic groups. Thank you so much for your attention. This is Joanne Manson.